Good day everyone, I am Francis Miss Yap, your second year student nurse from Davao Doctors College, and today I am going to perform the return demonstration of parenteral administration, such as the intradermal, intramuscular, and subcutaneous injection. So this return demonstration is a medication that enters to our body through the tissue and circulatory system. So first things first, let's check the doctor's order and check the medication administration record, and of course check if the label of the medication being prepared was correct. So now let's organize the equipment, and of course let's perform hand washing to prevent the spread of the microorganisms and perform or observe the appropriate infection prevention disease. So now let's prepare the medication vial for drug withdrawal. So first things first, let's mix the medication by rotating to our hand and not by shaking. Then after this, let's remove the cup or clean the rubber cup if the medication or the vial was previously open. So this medication vial was previously open, so let's rub this with the antiseptic swab or antiseptic wipe, rubbing it into a circular motion. So now let's proceed with withdrawing the medication. So attach a filter needle from a pre-mixed liquid medication into a multi-dose vials. So ensure that the needle was firmly attached to the syringe. So filter needle prevents gas particles from being withdrawn with the medication. Then now let's proceed removing the cup from the needle. Then draw up air equal to the amount of medication to be withdrawn. Then after this, carefully insert the needle into the vial with upright position. Then withdraw the air into the vial. After this, gradually withdraw the medication into the syringe. Then prepare the medication and proceed to the client. So now let's greet the client politely and introduce ourselves. Then identify the client with the two identifiers such as his or her name and of course her birthday. Then of course explain the procedure to the client. Then tell the client that this medication will provide blood to her skin, and he or she can feel slightly prick when the needle was inserted into her skin. Then of course, don't forget to establish good rapport so that the client won't feel uncomfortable. Hi ma'am, I'm Franz, your attending nurse for today. So first, may I know your name?
Althea, ma'am.
When is your birthday, ma'am?
February 16, 2002, ma'am.
Okay, so by the way, the procedure that I will be doing today is that I am going to give the medication through intradermal injection. So this is for us to know if you have any allergies and of course to know your skin sensitivity. This may hurt a little and this will cause a blood like a mosquito bite. So is that okay with you?
Sige lang, ma'am.
Okay, so by the way, ma'am, do you have any clarifications or concerns?
Wala naman, ma'am.
So as you can see, ma'am, the curtains are closed so that there will be no other people who can see us.
Sige.
So let's start right away.
Yes, ma'am.
So now let's select a site, a forearm about hands with above the wrist, or 3 to 4 fingers with below the antecubital space. So avoid using sites that are tender or swollen or have lesions. So apply clean gloves as indicated by the agency policy. So now let's cleanse the skin at the site using a firm circular motion and ask permission before doing so. So ma'am, manipyuhan na ako ma'am ha.
Sige, ma'am.
So now prepare the syringe for injection. So remove the needle or needle cup while waiting for the antiseptic to dry. Then expels any air bubble from the syringe. So small bubbles that adhere to the plunger are of no consequences. Now grasp the syringe in your dominant hand close to the hub, holding it between the thumb and forefinger. So hold the needle almost parallel to the skin surface with the bevel of the needle up. So the possibility of the medication entering the subcutaneous tissue increases when using an angle greater than 15 degrees. So now let's proceed in injecting the fluid. So ma'am, mag-inject ako ma'am ha.
Sige, ma'am.
So with your non-dominant hand, pull the skin of the site until it is taut. So taut skin allows easier entry of the needle and less discomfort for the client. So now let's insert the tip of the needle far enough to the place of the bevel through the epidermis into the dermis. So now inject the medication carefully and slowly so that it produces a small wheal on the skin. So this verifies that the medication enters the dermis. Ma'am, mag-inject ako ma'am ha. Medyo sakit na siya ma'am ha. Now, let's withdraw the needle quickly at the same angle at which it was inserted. So, activate the needle safely device. So, remember to do not massage the area. So, massage can disperse the medication into the tissue. So, dispose the syringe and the needle into a sharp container. And, of course, remove and discard the gloves. So now let's perform hand washing. So now, lastly, document all the findings. So document all the relevant data, and of course, after 30 minutes, go to the client and observe if the client has positive or negative in skin test result. So now for the subcutaneous injection. First things first is to check the doctor's order and check the medication administration record. Then now carefully check if the medication being prepared was correct. Then now organize the equipment. As you see, I already organized my equipment. Then of course, don't forget to do hand washing to prevent the spread of the microorganisms. And of course, observe the other appropriate prevention infection procedures. So now let's greet the client politely, introduce ourselves, and identify the client using the two identifiers such as her name and birthday. Then of course, explain the procedure to the client so that she won't feel uncomfortable during the assessment. So information can facilitate acceptance and compliance during the therapy. Hi ma'am, I am Franz, your attending nurse for today. So first ma'am, may I know your name?
Althea, ma'am.
When is your birthday ma'am?
February 16, 2002.
Okay, so first ma'am is that the procedure that I will be doing today, because you cannot take the medication orally, I'm going to give the medication to you through subcutaneous injection. So while I am injecting ma'am, is that okay that you won't move for a minute?
Yes, ma'am.
Okay, so do you have any clarifications or concerns ma'am?
Wala man, ma'am. Padayo lang sa 5 minutes.
Okay ma'am. So as you can see ma'am, the curtains are closed so that there will be no other people who can see us. So after 5 minutes ma'am, I'll be right back.
Sige, ma'am.
So now let's select and cleanse the site. Select the site that's free from tenderness, hardness, swelling, or select the site that has not been used frequently. So this condition could hinder the absorption of medication and may cause increase the likelihood of injury and discomfort at the injection site. So before proceeding to the injecting, let's first apply clean gloves. So now, as agency protocol indicates, clean the site with antiseptic swab. So start at the center of the site and clean it in a widening circle for about 5 cm or 2 inches. So allow the area to dry thoroughly. So the mechanical action can remove this secretion, the skin secretion which contains the microorganism. So ma'am, maglimpyo ko ma'am ha. So now let's prepare or place or hold a swab between our third and fourth finger of our non-dominant hand, or position the swab into the client's skin above the intended site. So using the technique keeps the swab readily accessible when the needle is withdrawn. So now let's prepare the syringe for injection. So first, let's remove the cup. So pulse the cup straight off, avoid contaminating the needle by the outside edge of the cup. Then now, let's proceed injecting the medication. So grasp the syringe of your dominant hand by holding it with your thumb and fingers, so with palm facing side or upward for about 45 degrees. So now, using our non-dominant hand, let's pinch or spread the skin of the site and insert the needle using the dominant hand and firm steady push. Certain ako ma'am ha. So now when the needle is inserted, move your non-dominant hand to the end of the plunger. So holding the syringe steady and inject the medication at even pressure, minimize the discomfort of the client. So now let's remove the needle smoothly by pulling along the line insertion while depressing the skin with our non-dominant hand. So depressing the skin minimizes the client's discomfort after withdrawing the needle. If bleeding occurs, apply pressure to the site while with dry sterile gauze until it stops. So now, let the client hold the cotton ball. So ma'am, pwede niyo mo nigulitan ma'am. Then after this, dispose the supply appropriately. So now let's document all the relevant information. So many agencies prefer medication administration to be recorded into the medication record. So for the intramuscular injection, first things first is to check the doctor's order. So check the medication administration record. And of course, check if the medication being prepared was correct according to the MER. So now, let's first prepare the necessary equipment and of course, do hand washing to prevent the spread of the microorganisms. So now, after doing the hand washing, let's go to prepare the medication ampule for drug withdrawal. So first things first, let's go and get the ampule and flick the top of the ampule with our fingertips so that the medication will go down here and not to the top so that the medication will fix. So, I don't have any ampule opener, so we can use the sterile gauze so that we can open this ampule. So before that, let's first wipe with antiseptic wipe or alcohol pad to the top and the neck of the ampule. Then dispose the wipe. So now let's go and let's break the neck of the ampule by placing the sterile gauze and break it away from you and to your patient or to the client. So now after breaking the top or the tip of the ampule, dispose the tip of it to the sharp container. So now let's proceed with drawing the medication. So place the ampule into a flat surface, and of course let's proceed opening the needle or the syringe with a filter needle. Then remove the cup. So now let's hold the ampule slightly and insert the needle. Then avoid the tip of the needle touching the rim of the ampule. put the cap of the needle or the filter needle, then change the filter needle with the regular needle. Then now, let's proceed to our patient. Hello, ma'am. I am Franz, your attending nurse for today. So first, ma'am, may I know your name?
Althea, ma'am.
Okay, so when is your birthday, ma'am?
February 16, 2002, ma'am.
Okay. So, first things first, ma'am, the procedure that I will be doing is that I am going to give the medication to you through intramuscular injection. So, this medication will directly go to your bloodstream. So, while I am injecting, ma'am, I want you to not to move so that you won't get hurt. So, is that okay with you?
Yes, ma'am.
Okay, so as you can see, ma'am, the curtains are closed so that there will be no other people who can see us. So, any clarifications or concerns?
No, ma'am.
Okay. So now, assist the client into a chosen position, and of course, depending this into the chosen side. So appropriate positioning can give relaxation to the target muscle. So now, let's select a site free from skin lesion, tenderness, swelling, and one that has not been used frequently. If injections are to be frequently, alternate the sites. So avoid using the same site twice in a row. So locate the exact site for the injection. So before doing so, let me first clean my hand and apply gloves. So now, let's clean the site with antiseptic swab. Using a circular motion, start at the center and move outward about 5 cm. So transfer and hold the swab between the third and fourth finger of your non-dominant hand in readiness for the needle withdrawal. Ma'am, limpyo ko, ma'am, ha. So this will reduce the discomfort of injection site. So now, let's remove the needle cover. If using a pre-filled unit dose medication, take the caution to avoid dripping medication on the needle prior to injection. If this does occur, wipe the medication off the needle with sterile gauze, because medication left in the needle can cause pain when it is tracked to the subcutaneous tissue. So now, I am going to perform or use the Z-track technique. So, using the ulnar side of the non-dominant hand, I am going to pull the approximate 2.5 cm to the side. Under the circumstances, such as for an emaciated client or an infant, the muscle may be pinched. So pulling the skin and subcutaneous tissue or pinching the muscle makes it firmer and facilitate the needle insertion. Holding the syringe between the thumb and forefinger as if you are holding a pen. and pierce the skin quickly and smoothly about 90-degree angle. So after inserting the needle, use a quick motion to lessen the client's discomfort. So this is how you do the Z-track technique. You can pinch this part of the forearm to this side, then inject the medication through the forearm. So now, after inserting the needle or inserting the medication, use the barrel of the syringe steady with our non-dominant hand and aspirate by pulling back the plunger with our dominant hand. So aspirate for about 5 to 10 seconds. So if the needle is in small blood vessel, it takes time for blood to appear. If blood appears in the syringe, withdraw the needle. Then discard the syringe and prepare anew. If blood appears in the syringe, if blood doesn't appear, inject the medication steadily and slowly. So while holding the syringe steady, if using a ventral gluteal site. So injecting the medication slowly promotes comfort and allows time tissue to expand and begin absorption of medication. Holding the syringe steady minimize the discomfort. And after injection, wait 10 seconds if using a ventral gluteal site. So, ma'am, inject na nako ang ano, ma'am, ha?
Ma'am.
So, after withdrawing the needle smoothly, this minimizes tissue injury. So, applies gentle pressure at the site with a dry cotton ball. So, use an alcohol swab may cause pain or burning sensation if it is not necessary to massage the area at the site of injection. So, massaging the area of the site injection may cause leakage of the medication. If bleeding occurs, apply pressure with a dry sterile gauze until it is stopped. So, ma'am, okay lang gunitan yung nga site, ma'am. Mag-andam lang po pa naman. So, after this, activates the needle safety device or discard the uncapped needle and attach the syringe into a proper receptacle. Okay, so okay na, ma'am. So now, let's remove and discard the glove and of course perform hand hygiene. Then discard the equipment. So now let's document all the relevant information such as the time of administration, the route, the site, the reaction of the patient, and the dose. So assess the effectiveness of the medication at the time of the medication expected to act.